This lecture will wrap up managing empyema, which is at the end of the pneumonia section of chapter 31. You can find it on page 604, managing empyema. So the first thing is, what is pulmonary empyema? Pulmonary empyema is a collection of pus in the pleural space, most commonly caused by a pulmonary infection. When empyema is present, gas exchange can be impaired by both reduced lung diffusion and reduced effective ventilation. Empyema is suspected when chest wall motion is reduced, fremitus is reduced or absent, and breath sounds are decreased. Diagnosis is made by chest X-ray or CT scan, and a sample of the pleural fluid can be obtained via thoracentesis. Empyema fluid is thick, opaque, exudative, and foul-smelling. Treatment includes draining the empyema cavity, re-expanding the lung, and controlling infection. Appropriate antibiotics are prescribed. A chest tube to close chest drainage is used to promote lung expansion and drainage. The tube is removed when the lung is fully expanded and the infection is under control. Chest surgery may be needed for thick pus or excessive pleural thickening. Nursing interventions are similar to those patients with pleural effusions, pneumothorax, and infection. To wrap up pneumonia, we'll look quickly at, on page 605, home care management. Home care needs for the patient who's been discharged after treatment for pneumonia depend on the patient's level of fatigue, dyspnea, and family and social support. The long recovery phase, especially in older adults, can be frustrating. Fatigue, weakness, and a residual cough can last for weeks. Under self-management education, review all drugs with the patient and family and emphasize the importance of completing anti-infective therapy. An important aspect of education for the patient and family is avoiding upper respiratory tract infections and viruses. Teach the patient to avoid crowds, especially in the fall and winter when viruses are prevalent. People who have a cold or flu, and exposure to irritants such as smoke. A balanced diet and adequate fluid intake are essential. If your patient is a smoker, you want to provide them with information about smoking cessation. And you have a yellow box there. Warn the patient using nicotine patches or supplements of the danger of MI if smoking is continued while using other forms of nicotine. Under evaluation, what we would hope for this patient with pneumonia, that they attain and maintain adequate gas exchange, maintain patent airways, free from invading organisms, avoids empyema, and returns to his or her pre-pneumonia health status.